This is my assessment video. When I first enter the patient room, I want to provide for patient privacy, and I also want to make sure I perform hand hygiene. And then I want to introduce myself to the patient. Hello, my name is Anne Marie. I'm going to be your nurse today. Can I verify your name and date of birth on your wristband, please?
Yeah, absolutely.
Okay.
It's Rachel Strock, 11/30/98.
Okay. Well, Ms. Strock, since you have been admitted to the hospital, your physician has ordered a complete head-to-toe assessment. This is just for us to check and make sure everything's still working good. There's nothing else going on. So during this, I'm going to be touching you during certain points. Is that okay if I touch you during this exam?
Yeah.
All right. And before we begin, just a couple of questions. Do you have any allergies? Okay. And are you in any pain right now?
I'm not.
All right. And is there any reason that you know of that we shouldn't do this? Alrighty, so we'll just jump on into it, okay? Right. So, I know I just asked you, but I'm forgetful sometimes, okay? So, what's your name again?
Rachel.
Okay, where are you at right now?
I am at the hospital.
Okay, and what year is it?
It's 2020.
Okay, and who's the President of the United States?
President Trump.
Alright, so the patient is calm and cooperative. She is also alert and oriented. Her speech is not slurred, so her speech is clear and easily understood. So, can you smile for me? Okay, her face is symmetrical, so there's no sort of drooping on either side. So next what I'm going to do is I'm going to check your eyes. So if you can just stare straight ahead for me, I'm just going to shine this light into your eyes, okay? I'm going to check. Okay. That eye is good. Okay, that eye is good. And then, so what I want you to do now is I want you to focus on this pen and just watch it, okay?
Okay.
Alright, and then one more time, just going to get you to watch the pen, follow it with your eyes, not your head, okay? Alright. Okay, good job. So her perlet is intact bilaterally, so her pupils reacted like they should have. There's nothing of concern noted. Do you happen to wear any contacts or any glasses?
Glasses usually.
Okay, what's your vision with them?
20/25 in one eye and 20/30 in the other.
Okay, so usually we would use a Snellen chart to check her vision, but given where we are, it's a very poor rural hospital here with very limited supplies. So we're just going to make do with what we got. And so let's see. Next, do you happen to wear any hearing aids or anything to help with your hearing?
I do not.
Okay, so what I'm going to do is I'm going to lean behind you, and I'm just going to whisper something in each ear, and if you could just repeat what it is for me.
Okay.
Okay.
Pepsi.
Okay.
Coke.
Okay, great job, great job. So let's see. Okay, we've done your eyes, we've done your ears, we've done your small. Her skin is consistent and appropriate for race, so there's nothing of note there. Her speech is good. Her posture is erect, so she isn't slumped or anything like that, so she's good on that end. So yeah, so what I'm going to do now is I'm going to check your lymph nodes, okay? So I'm just going to palpate them. So first I'm going to check your occipital, okay? Then your posterior cervical, so that just means really behind your neck. Your anterior cervical, so in front of your neck. Your submandibular, then your submental, okay? And then your supraclavicle. Alright, so there was no tenderness or pain noted when we palpated those, so that's a good sign. Next, what I'm going to do is I'm going to check your carotid arteries. So I'm just simply going to palpate them to begin with. So I'm just going to touch you right here. Feel it. Okay? Okay, her carotid arteries are equal bilateral, so that's good. And then next what I'm going to do is I'm just going to listen and make sure there's no signs of brewery, which means like a whistling noise. So I'm just going to check and make sure that it's all good on that end. Okay, I'm just going to listen. All right, so there is no signs of brewery noted, so that's good. Nothing of concern there. So let's see. we've done that. We've done that. So next what I'm going to do is I'm going to check your breathing sounds, okay? So to begin with, I'm going to start with the front of your chest, and anytime I place my stethoscope down, if you can, just take a deep breath in, okay? And you also want to make sure you go in a ladder motion when you do this, so you don't want to like start up here and then skip to down there. You want to make sure you're going in a ladder motion that's consistent. So, let's see. Okay, and if you could just take a deep breath in for me. Okay. Sorry. Alright. Her anterior lung sounds are equal bilaterally. There's no signs of things like gurgles, pops, crackles, anything wheezing. So there's no signs of that. Her breathing's also quiet, effortless, and rhythmic. So she's not looking like she's struggling or using her accessory muscles. So next I'm going to check your posterior, which is your back breathing. So again, if you can, just take a deep breath in every time I place the stethoscope down. Okay. All right. So her posterior lung sounds were clear and equal bilaterally. Again, there was no signs of wheezing, snap, crackles, pops, any of that. So that's good. So next, what I'm going to do is I'm going to check your heart. So there's 5 areas that I'm going to check. So I'm going to check her aorta, her pulmonic, her Erb's point, her tricuspid valve, and then her mitral valve. So first I'm going to start with your aorta. Okay. Her pulmonic. Her Erb's point. Her tricuspid valve. And then her mitral valve. And so I heard S1 and S2 without murmur, so there's no extra heart sounds or anything to worry about with that. If she did have a irregular heartbeat or there was a certain medication that she was being given, I would want to take an apical heartbeat for 60 seconds in that 5th intercostal mid-clavicular line, that mitral valve. But she has a regular heartbeat, so there's nothing to worry about on that end. Let's see, what's next? Okay, well, I'm going to get you to lay down flat on your back for me. If you could do that for me, please.
You might want to tilt it a little bit so you can see it more.
Okay, let's see. Maybe.
Yeah.
There you go. Okay. So, first what I want to do is I want to make sure there's no JVD noted. So I don't see any JVD noted. And if she was to raise to a 45-degree angle, there's no JVD noted there either. And so now what I'm doing is I am checking her abdomen. So her abdomen is flat. It's not distended, and there's nothing that is looking like cause for concern. Her skin is also consistent and appropriate for her race. And so what I'm going to do now is I'm just going to listen to your abdomen. What I want to hear is I want to hear gurgling sounds in each of the 4 quadrants. You usually want to hear anywhere from 5 to 30 per minute. So I'm going to start, and I'm going to make sure I start in the bottom one right here and then work my way around. So, okay, let's see. All right. I heard intermittent gargling sounds in all 4 quadrants. And so now what I want to do is I want to palpate each of those quadrants. And I always want to make sure that I listen before I palpate, because if you palpate before you listen, it may make it to where you hear some sounds that come from the bowels being disturbed. So I'm just going to simply palpate. If you feel any tenderness or pain, let me know. Alright, so there was no tenderness or pain noted. So next what I'm going to get you to do is I'm going to get you to put your feet flat on the bed and put your knees up. Okay, can you squeeze my hand between your knees? Okay, can you push out against my, good. Can you push your ankle out against my hand? Okay, your other ankle. Okay, can you press up against my hands and then press down against my hands? Great, wonderful. Okay, so you can sit up now. And let's see. So, her skin color throughout her whole body is consistent and appropriate for race. There's no sort of anything that should be a cause for concern or anything out of the ordinary. Her temperature is warm and again appropriate, so there's not any cause for concern there. Can I see your hands, please, ma'am? And so what I'm doing now is I'm checking for capillary refill. So I want to make sure that her capillaries refill within 3 seconds. So hers did, which is good. Okay, can you grab my hands for me, please? Can you squeeze them? Good. Okay, can you put your arms up above your head like that? Can you push up? Push down? Okay, can you do your arms like this? Can you push out? Push in? Okay, can you spread them like this? Do a windmill? Great, wonderful. Let's see. Okay. Can you stand up for me, please? Okay, so what I'm going to have you do is I'm just going to have you walk simply to the mirror and back, just regularly. Okay. Patient's posture is erect. Her gait is steady. Her arms swing at her sides. Could you walk there on your tippy toes and then walk back on your heels? Okay. And then can you do your legs like this so we can check your hips? Okay. And can you do them in like that? All right, perfect. You can sit back down. And so we only have a couple more things. We're almost done, so don't worry. So next what I'm going to do is I'm going to palpate her pulses throughout her body. So we've already done the carotid. So now what I'm going to do is her brachial. So I'm just going to check your brachial, okay? So let's see. Okay. Okay, so her brachial are equally bilateral. So next I'm going to check your radial. So, okay, her radial are equal bilaterally. So next I'm going to check her, so usually you check the femoral pulses, but since, you know, we're just friends and that's kind of in an area, we're just going to say we checked them. Then I'm going to check her popliteal, which is behind her knee. Okay. Okay. Then I'm going to check her post-tibulus, which is right behind her ankle. And so those were both equal bilaterally. And then lastly, I'm going to check her dorsalis pedis, which is on the top of her foot. And that's also equal bilaterally. And so then I'm going to check your patellar reflex, okay? So I'm just simply going to check that reflex. So you may feel like a sharp little pain that makes your leg pop, but that's okay, okay? Okay? All right, and so let's see. Lastly, I'm just going to check sensation throughout your body. So this is sharp. That's dull, okay? And make sure you close your eyes. You don't want to cheat for this test. So I'm just going to place it on your body. So tell me what you feel and where you feel it.
Dull on my thigh.
Okay.
Sharp on my arm.
Okay.
A doll on my leg.
Okay, and then
Oh boy. Sharp on my shoulder.
yes. Okay, good job. So let's check. We checked your neuro, so your head, and then we've checked cervical. We've checked pulsus, your heart, your breath, your abdomens. We've checked your extremities. So yeah, is there anything questions you have for me?
No, ma'am.
All right. Well, this completes our assessment. Give me about an hour. I'm going to go document this assessment in your chart, and then I'll come back and check on you. If you need anything before that time, though, just hit that call out, and we'll be in here as soon as possible. Okay? When I'm leaving the room, I want to make sure that I leave the bed lowered and locked, and with at least 2 side rails up, and call out within easy reach. Before I leave the room, I want to perform hand hygiene, and then afterwards, I want to go make sure I document any findings or my findings in the electronic health